All right, good evening. I'm Robbie Miller, Tangelo Parish President. Thank you for being here. I appreciate you taking your time to come update yourselves on the activities of Tangelo Parish. I'll quickly go over the protocol for this briefing. I've already welcomed you, and then Mr. Carlo Bruno, our council chair, will make comments. Then Mr. David Vial, our council vice chair, will address you. Mr. Trent Forrest, council district number 1, and State Representative Bill Wheat, Dr. Bill Wheat, will also make some comments. Then I'll come back with an update from the parish, followed by Mrs. Melissa Stilley of the Tangelo Parish School System Superintendent, and finish with Dr. Rob Peltier, the Medical Director of North Oaks, and Ms. Michelle Sutton, the CEO of North Oaks. With that, I'll turn it over to Mr. Bruno.
Good afternoon, everyone. Wish we could be here on a different situation, but it is what it is, and we're going to work as hard as we can and do the things that we need to do to try to get through this as a community and a parish. First of all, I'd like to make an announcement that there's only 3 councilmen here today. We're trying to limit the number of people that were in the room today. We're trying to do some social distancing. But in the meantime, I'd like to mention all the other councilmen who are at home or at work who have been very active in their districts, keeping up with all of the updates that we're getting from all the different agencies that are reporting to the parish. Mr. Forrest is here. He will speak. He represents District 1 in the far north end of the parish. Mr. John Ingraffia is District 2. Mr. Lewis Joseph, District 3. Myself, District 4. Mr. Joey Mayu, District 5. Mr. Buddy Richtel, District 6. Mr. Lionel Wells, District 7. Mr. David Vihal, who you will hear from shortly, District 8, is also the Vice Chair, and Miss Bridget Hyde, District 9, and Miss Kim Coates of District 10. There's a few things that I'd like to pass on to the public. I just want to say that all of our councilmen are in touch with the administration. I want to say how much I appreciate the administration's hard work in keeping the council and all the other agencies in the parish on up-to-dates that are coming in from the state, the CDC, Homeland Security, and from all of our local agencies that are working hand in hand. There's going to be some steps taken as far as to ensure the safety of our residents and also our council and administration for Monday night's meeting. We are going to have a meeting Monday night, March the 23rd. That meeting will be closed to the public in here, inside the chambers, but we will have seating in the lobby area. The doors will be opened, and we will have cards for the public that anyone that needs to speak on an item or wants to address the council will fill out a card, and we will call that person in one at a time. We will not have more than the council and the parish president and maybe one of his assistants in the council meeting chamber at one time, so we can spread everybody out and keep them apart to keep the distance the way we need it. We're going to we're going to try our very best to discuss Monday night. There's possibility that this would be the last meeting for quite a while until the situation is under control, because the safety of not only our citizens but our council, which as it stands right now, 60% of our council is over the age of 60. So they're in the vulnerable stage, and we surely don't want anybody to pass it on to one another. But in closing, I'd just like to say let's all just keep cool. Let's just keep ourselves on a even keel. Everything's going to work itself out. We just got to listen to the warnings that our state and federal officials are giving us. And this might be a time to get together with your families and pray and see if you can help someone else, because I'm sure there's a lot of people right now that's going through some tough times. I thank you for that, and I'll introduce Mr. David Vial, who is our Vice Chair. He'll have a few words, and then Mr. Trent Forrest will be after him. Thank you very much.
Thank you, Mr. Bruno. Good evening. As Carlos said, I am David Vial, Vice Chair of the Parish Council, And first, I want to express my gratitude for the job the parish president and his organization are doing during these pressing times, and also want to commend them for keeping the public and the council informed. I also want to thank Mr. Bruno and the rest of my fellow parish council folks for their efforts and also for scheduling this opportunity to convey information to the residents of Tangipahoa Parish. I also want to take the opportunity to thank Ms. Sutton, Dr. Peltier from North Oaks, Miss Melissa Stilley from the school board, and also thank Dr. Wheat for being here. Again, I appreciate the opportunity to represent the entire parish council during these pressing times. And I can assure you, the citizens of Tangipahoa Parish, we are all working together. Obviously, as Mr. Bruno said, we only have 3 parish councilmen here, just so as a precaution. So, a few things, and then I'll move on to Mr. Forrest. We as a parish, a state, and a nation will make it through this. As you are aware, we as a parish have weathered many storms, hurricanes, 26 floods, snowstorms, etc. In this case, the area is probably much more widely affected. Remember, we can all have an impact on influencing the bending of the curve and thus influencing the duration of the virus by practicing social distancing, washing or sanitizing our hands on a regular basis. If no need to be out, stay home. Be smart, but no need to panic. If sick with possible symptoms, stay home, call the hotline 211 or the North Oaks hotline and or your doctor. Follow the guidelines of the federal government, the state government, and the parish. If you need more information, you can access ldh.la.gov.coronavirus, or you can look up coronavirus.gov. The parish are here to support the citizens in any way we can. If needed, all council phone numbers are on the Tangipahoa Parish website. A few things about the fire board, as I'm president of the fire board. As president of the Rural District Fire Board, I can report to you there has been no interruption of services as of this news conference. Precautions and procedures have been implemented during this event to protect our first responders. I've also met with the fire administrator and discussed additional precautions to implement if required. We will also hold a fire board meeting Monday night, March the 23rd, basically using the same procedures that will be implemented for the parish council meeting. Again, as a representative of the entire parish council, I can assure the citizens of Tangipahoa Parish that the council and administration will continue to work together for the betterment of Tangipahoa Parish and its citizens. Everyone, please exercise caution and stay safe. With that, I'll turn it over to Mr. Forrest.
Thank you, David. Good evening. As Mr. Davis said, I'm Trent Forrest, Parish Councilman, District 1, Tangipahoa Parish. We appreciate the opportunity to inform the constituents of Tangipahoa Parish and this state that the Parish Council government has been and will continue to work hand in hand with parish administration, state officials, hospital, and the federal government to do our best to protect the lives of our constituents. Information and data concerning the COVID-19 is vital for decision making for the government as well as the constituents of the parish, state, and country. We're doing as much as we can to obtain the information as soon as it's available and get that information out to the public as soon as possible. Due to the nature of a virus, the data concerning the spread and the areas of concern can change daily and even hourly. We as a parish government are following the lead of the federal and state governments and following their recommendations. It is much better to be in a proactive state than a reactive state. We must follow these proactive recommendations that have been set in place to slow the spread of the COVID-19. The reasons are twofold. By slowing the spread, the CDC and other agencies have more time to research and understand the nature of this virus. And another reason is attempts are being made to suppress the speed at which it is spread is to prevent the overcrowding at medical facilities. This should ensure prompt and adequate care for all constituents. To quote Aristotle, man is by nature a social animal. We as humans have a natural desire to congregate and socialize with groups of people. In an attempt to slow the virus, we've been asked to suppress that desire to socialize. What can you do to help in the next few weeks and months to come? Please refrain from your social gatherings and events. Follow the requests from the federal and state governments and their leaders. If at all possible, keep social distance. Recommendations are made based on information that is available today. As more research is completed and more information about COVID-19 becomes available, I would venture to say the recommendations will change. For now, be assured that the parish, state, and federal agencies are working together to combat this virus. Please keep yourself informed and adhere to these recommendations. Together, we will get through this troubling time as a parish, state, and country. May each of you be blessed in the coming days.
Good afternoon, folks. I'm Bill Wheat, State Representative, District 73, and I want to inform you a little bit about what's going on in Baton Rouge. As many of you already know, our session has been suspended until March 31st. That's the anticipated date that we'll next meet. With that in mind, the reason that decision was made was out of respect for the public to be able to participate in the process of government. To not allow meetings to go on without public input so that we know that we're doing it in the right vein. I want to tell you, though, even though we're not meeting in session, the responsibilities of our jobs is being upheld in Baton Rouge. We're in constant communication at all levels of government to work with the crisis that we're faced with, from our governor, our legislators, our senators, all levels of government, our parish president, our council members, on the local level, our mayors. I will tell you, there's times in our history when we're not very proud of government, but we should all be very proud of what's happening right now in government and the way people are working together to attack the virus that's inflicting our citizens. They've done earnest work, hard work, and I reassure you that at this point in time, everyone is working toward a positive end of this. I know decisions sometimes are made that the general public may not quite understand, but I want you to understand this, that those decisions, as hard as they are for the protection of our people. And please keep that in mind. So we're also here today as a representative from my profession, from a veterinarian. I've get many questions concerning how this affects people's pets. And you may already know this as well. This virus, from all we know about it right now, does not attack animals, and so we're very fortunate in that regard. But that doesn't mean that we have to be not precautious. Viruses can be spread on inanimate objects for a certain period of time. So all the protective measures that you would be doing to protect yourself, do so with your pets as well. Again, I want to tell you that we're here to serve our public. We're here as school representatives. We're here as hospital administrators, and all levels of government are working together to the betterment of our situation. I appreciate President Miller for allowing me to be here. If you need to reach me for whatever reason from a state government, 985-386-7844. Thank you very much.
Again, I'm Robbie Miller, Tangeville Parish President. And I want to thank our council and Dr. Wheat for being here to give those updates. And I can assure you that all of us are working very hard together as one group to make sure that we're protecting our citizens as much as possible. So in my comments, whenever I say we, I mean the administration, the council, our state legislators, all of us, we together are working to protect you, our citizens. So again, thank you for the time. In Tangeville, our motto is move here. And as you may have heard me many times, we move here when needed. And today we are going to be we're asking you to do that by continuing to follow the executive orders of Governor John Bel Edwards. These restrictions have been developed by our health officials and are best practices learned from around the world for limiting coronavirus or COVID-19. As you have heard, these measures are to protect us from overrunning our health system, and in our case, headed up by North Oaks with Hood Memorial and Lolly Kemp Hospitals. We have been working hard together in almost constant communication with North Oaks, so we are fully informed and we truly appreciate the efforts and plans that they have put together. And in just a moment, North Oaks will update you on those plans, along with Mrs. Stilley for the school system and all the hard work they've been doing and the plans they've worked on to make sure our children are protected and educated. All of our efforts are to protect the safety and well-being of our citizens, and most importantly, honoring our experienced citizens as coronavirus affects them more significantly. We're asking our citizens to help by continuing to follow more closely the guidelines, with social distancing being most significant. Like the concerns of our citizens, we always put the best interests of our employees as top priority. But we are public servants, so all of our employees are coming to work unless they are ill or they are having issues with child care because of our children being out of school. In order to protect our employees and provide services, the parish is limiting public access to our facilities. In some cases, we're closed to the public completely, and in others with limited access or limited entrance. While we continue to provide the allowed services, we're using phone calls, online, or fax as much as possible. You can find our phone numbers, emails, and online services at tangiboho.org. And you can also find numerous amounts of information about the coronavirus and links to other sites. Currently, we are waiting for the details of the Federal Government Relief Act, and as I understand it, it just passed the Senate and on the way to President Trump for signing. So as those details become available, we will make sure that we put that information out. And I can assure you that Louisiana and Tangipahoa will be ready for any and all assistance which will be available to our citizens and businesses, and we will be included. So what can we all do? First of all, we can relax, take a deep breath, and know this too shall pass. Follow the guidelines. Wash your hands frequently. Wipe surfaces. Cough, sneeze in your sleeve or tissue. Avoid crowds by social distancing. And at this point, let's enjoy our time with our families since we get to do it so much more. Additionally, to help our businesses, visit them by going pickup, drive-through, or delivery service. Those are the businesses that employ our citizens and sponsor all of our teams and events every year. Let's help keep our small businesses going. And there's another opportunity that just came up in the last actually today. You've heard that there's a blood shortage in our hospitals and around the country, so it's happening here locally. The Blood Center will be hosting a couple of blood drives over the next week. One will be at North Oaks this Friday, which one of our North Oaks administrators will give details on. And the second one will be in downtown Hammond next Wednesday, March 25th, in the parking lot next to PJ's downtown on Thomas Street. They will have 3 blood mobiles there, and the Blood Center will absolutely be using best practices for screening and social distancing during that blood drive. Remember, we are all in this together, and we will come out of this stronger and better by helping each other. And know this, Philippians 4:13, I can do all things through Christ who strengthens me. May God bless and keep you. Thank you. Ms. Stilley.
Good evening. My name is Melissa Stilley, and I'm the superintendent for the Tangipahoa Parish Public School System. Friday afternoon, we received word a little after 1 o'clock about the closing of our schools across the state, and I'm happy to say that within 72 hours of hearing that, our people, our employees had begun to contact parents and families to let them know about the resources available. We uploaded on our website many, many resources that families can access, even from a smartphone, to keep their kids connected to the learning that they would be missing in the classroom. We immediately put that out. We put a frequently asked questions document on our website as well. And as we get questions from families, and our employees, we update that continually. So I encourage the public that if you have a question regarding your child with promotion, or if they're a student with disability with an IEP, to please go to our website at www.tangischools.org and look at the information on there, as well as all the resources, which are very, very, friendly for students. It's very easy to access, and it will help keep them on track. In addition to that, we'll be pushing out additional resources that will be available for families through the Louisiana Public Broadcasting System, through YouTube videos, and so any new updates that we have in terms of instructional material, we will be pushing that out. We'll be primarily using our website. We will also use social media, the Tangipahoa Parish School System social media Facebook page, as well as our direct email that we do to our families. So we ask our families to stay connected. They can go to our website and register for the electronic survey, the electronic newsletter that we push out. And so the big important thing here is just to continue to monitor the resources that we're releasing and to know that those resources can assist with your child during this time. Our schools and our teachers have reached out to parents personally and talked with them and answered any questions that they had as well. Our teachers across the parish have their Google Classroom set up with instructions for students, as of ordering additional Chromebooks for students for more virtual learning for our students that do not have devices at home. Of course, we continue to struggle in certain areas of our parish where they do not have Wi-Fi or internet access. That's one of our challenges. Today, we started serving our meals for our students. Any child that's 18 or below, even 2-year-olds, 3-year-olds and families. We do curbside, grab and go. We do a breakfast and a lunch. Today was our very first day, and we distributed over 4,100 meals to families in our parish. And we know tomorrow, we've been sharing those pictures and things on social media, and we know tomorrow we'll have it even more. Each day, our principals and our district leadership team meet through a Zoom call, and we debrief and we talk about next steps and additional resources and information we need to pass on to our families. And of course, we'll do that through our Facebook page and website and so forth. We also have made decisions in terms of our employees. All of our buildings, facilities are closed to the public effective tomorrow. And so, the public is not there. And then our employees we're implementing practices that will keep our employees safe through the social distancing measures, where we have essential personnel who are working with things like the meals that we're providing our students at work, but practicing those measures while they're there. And so we'll continue to do that. We use the technology tools, just like many of our other agencies, with Zoom calls, conference calls, Google Docs, and collaboration and things like that. So we just want to urge the public to stay connected to the information that all of our agencies are putting out, and also to continue to spread the word about the meals that we have for children. And other adults in the community, today we had some of our area churches that picked up meals for children and delivered them into neighborhoods where maybe they didn't have transportation to get there. And so we're asking our community, everyone, to look out for each other. And if you know there's a family that lives next door with children, or you know that there's someone down the street that may not be able to access these meals, to offer to pick those up for them, and or at least have maybe a schedule where you're carpooling and taking turns. We will continue to provide meals Monday through Friday. We serve from 11 o'clock to 1 o'clock. That's the curbside pickup. And we will continue to do that until the Thursday before Good Friday, which I think is April the 9th. If you have any questions, you can email me directly. You can also email our inbox that we have for any questions you might have regarding anything. And it's questions@tangischools.org. And I wish you the best, and God bless. Thank you.
Hi, I'm Michelle Sutton, and I'm the CEO of North Oaks Health System. On behalf of our Board of Commissioners and 2,700 employees, we want to thank parish government because they have done an unbelievable job leading this situation and working closely with us. We met several weeks ago to talk about our COVID-19 mitigation plan, and from that, the ball has just skyrocketed. We implemented back on Monday, March the 9th, our very first drive-through for CV testing. And you have to be symptomatic, but we wanted to make it where it was the most safe for the public as well as for our employees. And we continue to do that Monday through Friday. Yesterday, we had over 65 people come through and be scheduled in that drive-through for testing. This is a very fluid situation. We're meeting multiple times during the day with our leadership team to ensure that as we get new information, we're pushing it out to our employees and to the community. For example, late this afternoon, we just got word, and I have a team back at the hospital right now working, and that is we have a directive from the state of Louisiana, and I'll read it to you. It says the Department of Health is committed to taking critical steps to ensure public health and safety to prevent the spread of COVID-19. The state of Louisiana Department of Health is directing and requiring that all licensed healthcare facilities in Louisiana and all healthcare professionals licensed by the State Board of Medical Examiners or the State Board of Nursing adhere to the following provisions, restrictions, and limitations effective immediately. The department hereby directs that any and all medical and surgical procedures that in the medical opinion and judgment of the physician or other appropriate healthcare professional acting within the scope of his or her license can be safely postponed for a period of 30 days shall be postponed for a period of 30 days. This period shall run from March 19th through April 21st, unless it's extended by the department in writing. So what does that mean? That means right now we have a team back at the hospital. We're in contact with physicians. We're looking at what outpatient surgeries are scheduled for the next 30 days, which ones can be postponed safely. We're also looking at appointments, diagnostic testing, after consulting the physician to see which ones can be postponed safely, that it wouldn't worsen the condition by putting it off. Again, it's very fluid. We're making phone calls tonight. We'll be making them over the next several weeks as we try to reschedule thousands of appointments and surgeries. Additionally, we've made changes to our emergency department. We started a construction project yesterday. It will be completed by Friday, where we're actually dividing the emergency room into two sides. So we'll have one side strictly for respiratory type illnesses. So we'll do triage outside to see if you go to the chronic condition or a life or limb threatening side, or if you go to the respiratory side. Again, trying to maintain a safe distance for people waiting to come in for us to evaluate. Another thing that we have done is we have limited visitation. And at this point, we're limiting one visitor who must be 18 years or older to see our patients. However, today we started taking temperatures as well. And we will continue to take temperatures and screen visitors to ensure the safety of our staff and our patients. Again, this is very fluid. It could change depending upon the latest direction that comes down. Additionally, as you heard President Miller state, our community and state is in need of blood, so we will hold a blood drive on this Friday, March 20th, from 7:30 in the morning to 3 p.m. in our outpatient diagnostic center. So if you are able to give blood, we ask you that you come, and we'll put you in a staging area before we take you back to get the blood. If you have any information, I urge you to look at our website, northoaks.org. Additionally, we have set up a telephone line for the public where we're posting updates because, again, The situation is very fluid. That phone number is 985-230-INFO. We truly are committed to making a difference and into improving the lives of our community. I would be remiss if I didn't talk about two superheroes who are making a difference and leading this from a medical standpoint. One is our infectious disease physician, Dr. Stacy Newman. She has overseen every test coming in to ensure the safety of our patients in our community. And then Dr. Rob Pelche, who is our Chief Medical Officer. Back in January, he started monitoring this situation so that we were prepared, started putting together PowerPoints. We started meeting back in January in preparation for what if. We never thought it really would happen, but he was right, and it did. So with that, I'm going to ask Dr. Pelche to come forward.
Good evening. Thank you, Parish President Miller and Mr. Bruno and the rest of the councilmen, and Ms. Stilley and Dr. Wheat. My job is to give you an update about what's going on clinically, what's happening at the hospital. So here's our numbers for today. We just surpassed 200,000 people worldwide with this particular illness confirmed. Please note there are many more than that. In the United States, as of this morning, we had more than 6,000 confirmed cases. In the state of Louisiana, as of this afternoon, the latest update on the LDH website was that we had 240 cases, and unfortunately, we've lost 7 of our fellow citizens to this illness, which is disheartening. In Tangipahoa Parish, we have no confirmed cases, but please know, I am absolutely convinced that we have cases present. They just have not we haven't received their testing back yet. This test process takes a while and can be up to 5 days or longer. But I'm convinced that some of the people in our parish will be positive for this particular illness. And that's unfortunate. And you need to assume that people are positive. Don't wait until we have cases to practice social distancing. So social distancing works to spread this disease out. If you look at most of the studies that are present, social distancing's purpose is to ensure that all the cases don't happen at the same time. We would get overwhelmed at the hospital if all of our citizens in our parish and local areas needed to come in and use our resources all at once. That practice means doing all the things you can to stay away from other people. Stay in your homes if you can. Make as few trips as possible to the grocery store and the pharmacy, and to certainly no social events or those kind of things. All help. I liken this to getting the flu shot. We know from even a study published in, it was in the Washington Post this morning from CDC numbers. We know with the first 100 deaths in the United States, there's an analysis of the patients, and it seems to parallel what we've seen in other countries. More than 85% of the patients were greater than 60 years of age. 1/3 of the patients who perished were in residential facilities like nursing homes. But we also know that the fatality rate for people even without comorbid conditions is about 0.9%. Doesn't sound like much, but I will tell you that's 6.5 times our flu rate. But for those individuals at most risk, it can be up to 14%. That's an amazing mortality rate, and it's very concerning. Please do everything you can. You get a flu shot. Most people should get a flu shot, not for themselves. Yes, they may not get the flu, but what you're doing is, in general, especially if you're a young, healthy individual, you get the flu shot to stop others from potentially dying. All those people that have comorbid conditions like heart failure and hypertension and diabetes and cancer, many times they perish because of the flu. That could have been prevented by getting flu shots. Please go get your flu shots if you haven't already done that, and practice social distancing as much as you possibly can. So what do you do if you get sick? Here's our recommendations. Most people, we know from at least the limited data that's out there, about 80% of people will have very mild symptomatology. Bad cold, fever, cough, chills. Most of us have had the flu. We remember it. It's not fun, but it's not bad. Some people will even be generally asymptomatic or just feel malaise, or that feeling of fatigue and tiredness. But we do know that 20% of people will have more severe disease, and from one of the studies, we have a hospitalization rate of near 15%. Those patients tended to develop a pneumonic process, pneumonia, infecting their lungs, and needed to be hospitalized. This did require significant resources. We do need to judiciously use all of those resources. So if you have mild symptoms, our recommendation is you stay home. You take care of yourself. Do all those things that you've heard for years when you have a cold or a flu-like illness. You can certainly take some Tylenol and those kinds of medications if you have a little fever. Stay hydrated, get plenty of rest. If you start to develop more severe symptoms, and I would describe most of those symptoms as starting to get really particularly short of breath, you need to contact your physician for further instructions. At North Oaks, we've set up a hotline for our public to call when they have symptoms. Like it's been repeated a few times from the various people that have been up here tonight, if you just have questions and are curious and need information about the disease itself, call the hotline that the governor has set up, and it's 211. Everybody remembers 911. 211, call that and they'll have your questions answered. If you are getting sick, please call 985-230-2778. I'll repeat that again, 985-230-2778. You'll be put into a process that we do this during business hours throughout the day. You'll be placed in a queue where you will be screened. They will ask you some questions to help them decide where you need to go. Most people, especially if you have technology where you have a phone that can do video visits, you'll be directed to you'll get a link text to you where you will get into a queue, and when you'll eventually have a video visit with one of our physicians or nurse practitioners who will try to assess how sick you are and direct you to proper care. At North Oaks, what we've done is we've set up our 3 walk-in clinics and our Hammond Family Practice Clinic as the places that we're directing patients. So again, we can separate the patients that may have a upper respiratory infection like COVID or flu or those kind of things to try to sort out from the patients that are having their routine visits with their physicians or have follow-up appointments for recent surgeries or cancer or all the other things that we take care of every day. When they do the video visit, they're trying to determine how sick you are and to properly send you to the correct area. Sometimes that area is home. If you're having very mild symptoms, their recommendation is to stay at home, to get rest, etc. They are going to direct those patients that they're worried about getting sicker to those facilities that can evaluate them. Those particular facilities have chest x-ray capability and some lab ability functions, and they will help diagnose you and determine where further to go. As far as testing for the COVID virus, there's been a lot of different information that's gotten out there, and it's very confusing from a standpoint of what you hear on the news and what's available locally. The biggest limitation in testing currently is the number of test viral media kits we have. So when you have a laboratory, we collect a sample and we send that sample to the lab where the lab gets run on a machine. Luckily, we've been able to ramp up nationally our ability to run the COVID testing. That is done at national labs as well as our state epidemiology lab. But it's a matter of getting the sample to those labs, and those kits that we collected are special viral media kits that keep that sample stable until it can be tested. Those are limited. Because of that, we are trying to judiciously use those tests and reserve those for the patients that, like we said, are very sick and we're worried about their clinical outcomes, so we want to direct them to the right level of care and understand if they're COVID positive or not. When tests become more widely available, you may start to see things where we are screening patients for COVID and asking anybody that wants to come in to be tested. That is not where we are at this time. We have very limited number of tests. So right now, that drive-through that Ms. Sutton just spoke of is limited to those patients that have a physician ordering those particular tests. So whether you've gone through the hotline or your primary care provider has determined that you're ill, in general, they're going to want to run a flu test because flu test still is the most prominent illness out there. They want to make sure that you're flu negative, and they may run some other viral panel test first. But after completing that, they will, if they feel it's appropriate, they will direct you. They will write an order, it will come to the hospital. The hospital will subsequently give you a call and set up a time for people to arrive and have a testing, just like a clinic appointment. This would be a drive-through appointment. At that drive-through service, you will stay in your car. We are trying to protect our healthcare workers by having as little interaction with potentially ill people as possible, and to protect our personal protective equipment, our PPEs. So they will be dressed out in their gear, and they will collect it right in your car. They will verify who you are and collect the sample and send it, and you just drive off. Unfortunately, it does take about 5 days from the test to return to us. So at that time, you go home, you stay in your home, try to separate from your family members who may be healthy as best you can, and call us if symptoms change. You can call that same hotline, that 985-230-2778. I can't reemphasize anymore the necessity of the blood and the blood drives that are coming up. Please understand that blood is not used for COVID, but blood is needed. We still have traumas in our parish. We're going to still have heart surgeries that need to be done emergently. And when we don't have blood, the risk of those surgeries and whether we can proceed with them and the outcomes drastically change. If you're young and healthy, please contribute by going and donating blood and getting our reserves to appropriate levels. Again, I want to repeat those information numbers. If you have questions about the disease itself, call 211. If you are sick and you need care, please call 985-230-2778. You will go through our triage service. We have a ton of information on our website, www.northoaks.org/coronavirus. There you'll find videos on hand washing, on our blood drive. We've done, I think I'm up to 4 weekly videos about the coronavirus. You can send in questions on our website, as well as our Facebook page and our Twitter account at North Oaks. You can send in questions. We try to do videos to answer your questions. But again, you can always call 211. Every morning at about 7:05, I'm doing Johnny Chauvin's show on our local radio station, so you can tune in there and get an update on a daily basis. Please get as much information as you can. All that information will reduce your anxiety about this particular illness. As more information comes out, we'll know more and more about how best to treat all of our citizens. Thank you for this time.
Again, I'm Robbie Miller, Tangeville Parish President. I want to thank everyone for being here. I want to especially thank North Shore Broadcasting for being here to broadcast this live over the 3 radio stations. I want to thank Channel 17, Action News 17, Nortec out of downtown Hammond for helping get all this technology going so everybody could have availability to watch it. Obviously, North Oaks and our parish council and parish government are working diligently to make sure you're protected. The school system is doing everything they can for our children, and we're all working together as one big team. I know there was a lot of information given here today. Remember maybe a few key pieces: northoaks.org, tangibaho.org, tangischools.org, correct? So those are 3 places that have links to all of this information to make sure that you're up to date to get the details, because most of this was overview, but there are a lot of details at all of those sites to make sure that you are up to date and have everything you need to move forward with to take care of your family. Remember, wash your hands. We actually need several things, but whenever you wash your hands to time it properly, saying that Our Father is a real good timer, gives us both things we need. We wash our hands and we get some prayer in at the same time. We hope that everybody got some good information here tonight. We thank you very much for being here. God bless you. Thank you.